Good day, I'm Hanz Nicole from BSN-4D, and today I will be performing my return demonstration of inserting and administering a tube feeding and removal of the nasogastric tube. In preparation for the procedure, the nurse takes into account the following safety precautions. First, perform hand hygiene. Then, check the room for additional precautions. And introduce yourself to the client and confirm the client's identity using two client identifiers. Good day, ma'am. I am Hanz Nicole from the NUST, and I will be your student nurse for this morning. May I know your name, ma'am? And your date of birth? Okay, thank you. Then explain to the client what you're going to do. Offer analgesia and bathroom use. Then listen and attend to the client's cues. So for this morning, I'm going to insert a thin tube to your nose, and this tube will go down to your stomach. In this way, we can introduce some food and water to your body, so we can provide you with the nutrients you need for the day. And this procedure may be a bit uncomfortable for you, so would you like me to ask your doctor for any analgesia to ease your pain or discomfort? Okay, so have you gone to the bathroom already, or do you feel the urge to go to the bathroom now? Okay. Then, ensure the client's privacy and dignity by closing the door to the room or by closing the curtain around the client's bed. And assess the client's oxygen, safety ABC, as well as their suction if there are any. And to provide safety, we can raise the side rails on the other side of the bed. And apply principles of safety and sterile technique. Check the client's vital signs, including their oxygen saturation, and complete any other focus assessments.
Perform hand hygiene. Check the doctor's orders for the type of NG tube to be placed and reason for placement. Gather your supplies. You will need an NG tube, water-soluble lubricant, cloth tape or hypoallergenic tape, scissors, 50mm syringe with catheter tip, pH paper, glass of water with straw, towel or tissue paper, MSS basin, stethoscope, clean gloves, and a safety pin. Visually inspect the condition of the client's nasal and oral cavities. Assess for the best nostril before you begin. Do this by occluding one side and asking the client to sniff. Ask the client about previous injuries or any history of a deviated septum. Then palpate the client's abdomen for distension, pain, or rigidity. And auscultate for vowel sounds. Included in this assessment is your assessment of the client's level of consciousness and understanding of the procedure. Position the client sitting up at 45 to 90 degrees unless contraindicated, with a pillow under the head and shoulders. Raise the bed to a comfortable working height. Agree on a signal the client can use if they wish for you to pause during the procedure. Place a towel on the client's chest and provide facial tissues and an emesis basin. Provide the client with drinking water and a straw if the client is not fluid restricted. And stand on the client's right side if you are right-handed and the left side if you are left-handed. Apply clean, non-sterile gloves. Coil the NG tube on your fingers as this will soften the tube to facilitate easy insertion. Then, measure the distance of the tube from the to the earlobe and to the xiphoid process, and then mark the tube at this point. Be careful not to touch the patient's gown. Lubricate the NG tube tip according to your agency policy. Curve 10 to 15 centimeters of the end of the NG tube around your gloved finger. And have the client extend their head backward and drop head forward when the tube moves to the nasopharynx and breathe through the mouth. Insert the NG tube tip slowly into the client's nostril and advance it steadily in a downward direction along the bottom of the nasal passage, with the curved end pointing downward in the direction of the ear on the same side as the nostril. You may feel slight resistance as you advance along the nasal passage. Twist the tube slightly and apply downward pressure and continue trying to advance the tube. If significant resistance is felt, remove the tube and allow the client to rest before trying again in the other nostril. If there is difficulty in passing the NG tube, you may ask the client to sip water slowly through a straw unless oral fluids are contraindicated. If not allowed, ask the client to try dry swallowing while you advance the tube. And continue advancing the tube until you reach the mark or tape you had placed for measurement. Temporarily anchor the tube to the client's cheek with a piece of tape until you can check for correct placement. Verify tube placement according to agency policy. Color-coded pH paper is usually used as an initial and interim check to confirm that acidic contents are present. Then, an X-ray is taken to confirm placement prior to using NG tube for feeding. Once tube placement has been confirmed, mark with a permanent marker and record the length of the tubing extending from the nose to the outer end of the tube. Secure the tube to the client's gown with a safety pin, allowing enough tube length for comfortable head movement. Document the procedure according to agency policy and report any unexpected findings to the appropriate healthcare provider. This ends my demonstration. Thank you for watching.